My journey with martial arts started when I was 15. Originally, I wanted to learn it so that I could defend myself, but it actually evolved into a very good complement in my fitness routine. I am Dan. In the course of less than a year, I had 2 hip replacements and 1 full knee replacement. My practice of martial arts has, adjusted itself over the years. When I first started, I was doing a lot of very flashy stuff. And now that I have matured, it has evolved more into a means to promote my health. As I became older, I began to notice pain. I began to notice loss of mobility. When I first met Dr. Hekwasu, the first thing I realized that he's a big guy with a big heart. One thing that impressed me is when he told me the diagnosis. I said, hey, I don't know if I'm ready for this. And he said, look, I'm not gonna force you, and I'm not going to push you.
The goal for all of our patients when we first meet them, we try to figure out ways to treat them without surgery for as long as possible, particularly the younger patients. And for him, while we did shoot for the non-surgical goals, the pain and the dysfunction got to the point to where a hip replacement was the right move. We pretty much used J&J products throughout his entire prosthesis for both hips. STRATAFIX we've been using for a number of years with great satisfaction. We have a great deal of confidence in that closure, which allows patients to get to a higher degree of activity sooner without having to worry about a wound dehiscence or any sort of wound complications.
After my second hip surgery, I told Dr. Hekwasu that I was so grateful for giving me my life back. When I see my scars, all that I think of is that now I have a knee that can have probably more promise than I had before, hips that are healthier. I am happy.